you got. So because that is very important. Okay, so the orofacial pain. The overview of orofacial pain for dentists. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Pain is a subjective experience influenced by both sensory inputs received by the brain, example in response to inflammation, and the brain's interpretation and sorry of these inputs in the context of other available informations. Okay, for example, a patient's pain experience may be influenced by the coping strategy, previous experience with the pain and pain relief, and their confidence in the clinician ability to diagnose and manage their condition. So pain does vary between individual, because generally we have seen the female would be, or females are more concerned, or they would show more concern if they are in pain as compared to male. But it could vary between different individual. So these are some of the factors. Even the confidence on the clinician's ability can also affect the pain experience by the patient. Artificial pain has many causes, only some of which are dental. Okay, if the patient, so you just need to work on the dental cause. So because orofacial pain could be from the TMJ, or it could be from any other like trigeminal neuralgia, right? So any other conditions which are causing the pain to the patient. Okay, so like the cluster headache. So the patient would complain, like, my pain is coming from this tooth or any sinus. Patient could complain to you like the my pain is coming from this upper back tooth. Can you take my tooth out, or can you do the root canal? But sometimes the cause of the pain could be medical as well. So you just need to find out if there is any dental related cause for this pain. Otherwise, refer them to the medical assessment. If the patient's pain is of dental origin, then assess which type of pain it is. Like we will read here, like nociceptive pain, neuropathic, or nociplastic. Okay, then you also need to understand what is the duration. Is it the acute pain or the chronic pain? Because these factors affect the optimal treatment strategy. Nociceptive pain are those which arises from activation of nociceptors, like receptors in skin and deep tissues that are sensitive to potentially noxious stimuli. Due to threatened or actual tissue damage, example inflammation in irreversible pulpitis. So this is mainly the pain that we do see patients more commonly coming with the pain. For example, inflammation in irreversible pulpitis. So we generally deals with nociceptive pain. Okay, then neuropathic pain arises from injury or disease of the somatosensory nervous system. It is often described as a burning or tingling sensation. Oral neuropathic pain is not uncommon. It can be difficult to diagnose, and investigation by a dental specialist may be required. So there are some patients who can complain about, any nerve related pain, or the pain in which where you cannot find anything in patient's mouth. Then sometimes it could be related to neuropathic pathway, and you may need to refer the patient to the specialist. Which specialist? Oral medicine specialist, oral surgeon, oral and maxillofacial surgeon. Then the nociplastic pain. So it is a diagnosis of exclusion, where you have tried several methods, you have done several investigation, and you still could not find anything the cause. So it is a diagnosis of exclusion. It is considered when nociceptive and neuropathic pains have been ruled out. In nociplastic pain states, central sensitization is the key contributor rather than ongoing pathology. Then pain managed by dentists is usually acute dental pain, because patient, most of the patient does come to you when they are in pain, right? So they are at that time they are in acute pain, they are in severe pain that they cannot sleep at night, and the pain is disturbing with their eating, swallowing, or like all these things. That's the point where patient comes to the dentist generally. So that pain nature is nociceptive. usually resolves rapidly with the appropriate dental treatment but may require short-term use of analgesics. So they have stated this line, I think, so many times, even in the previous topic that we read there, that these painkillers or antibiotics are always an adjunctive therapy, but the best thing is to appropriate dental treatment. Serves a protective biological function. It alerts the body to a potential threat whenever we will feel pain from something. Okay, so our body would try to avoid that thing. Prevents the body from further harm and can teach the body to avoid similar harm in the future. Then the chronic pain. Chronic means the pain that is like dull, boring, ache, or which has lasted more than 3 months. So it is also called as persistent pain and may be associated with ongoing pathology. However, often the originating pathology is no longer evident and the pain persists because of lasting changes within the nervous system. Such pain may be nociceptive, neuropathic, nociplastic, or mixed. So the acute dental pain is always nociceptive only, but the chronic could be any. And it is difficult to diagnose because there may be and may not be any obvious pathology. May result in anxiety because patient would be in pain from so long time. The patient would have generated the anxiety, fear, depression, loss of sleep, and impaired social functioning. These factors may also affect a patient's pain experience. Then it requires a socio-psychobiological approach, which means the holistic approach of the patient. You may need to see the patient regularly for longer time and you need to provide him ongoing support. So they do require holistic approach to assessment and management. Causes of chronic orofacial pain include temporomandibular disorder and burning mouth syndrome. Then, if a patient with chronic orofacial pain presents with dental pain, so if this patient presents with the dental pain, determine whether the pain is a symptom of their chronic pain condition or associated with the dental pathology. Do not undertake dental treatment unless a dental pathology is confirmed to be causing the pain. Like, for example, the sinusitis patient, they would say because they would feel the pain in upper teeth, mainly the premolar to molar teeth, they would feel the pain. They would say to you, my pain is coming from this tooth. So do not do any irreversible treatment unless the diagnosis is confirmed. Then acute dental pain is usually inflammatory in nature. That's why the anti-inflammatory drug, which is the ibuprofen, would act best over these pains. Outline common causes of acute dental pain. Also consider conditions that are less common, difficult to diagnose, or not of dental origin, like always consider trigeminal neuralgia. It can also be mistaken for pulpitis. So refer the patient for medical assessment if their orofacial pain is not of dental origin. So you are dentist, so you are only working with dental problem, not a medical problem. You are not a GP. Okay. Dental treatment is the most effective means of reducing pain of teeth and the surrounding tissue. And to help the patient with the dental pain, best you can do for your patient is dental treatment. Dental treatment is the most effective means. All right. So, drug therapy has a more limited role and should only be used when necessary. So, medication always, whenever there is any scenario, they are asking you to prescribe any medication or something, just try to mold your patient to get the dental treatment first, and then the therapy would be only adjunctive. Patients with dental pain presenting to a medical practitioner. If the patient goes to the medical practitioner, which is the GP, so it could be in some condition, patient does go to the GP because the GP visit is almost free, but the dental appointments are very expensive in Australia. So sometimes people goes to their GP, and every person has their particular GP who they go to. So if the patient presents to the GP or medical practitioner, what they need to do, we will be reading in this table. Okay. So, if a patient with the dental pain presents to a medical practitioner and is unable to see a dentist promptly, then interim treatment may be needed. For initial management of common causes of dental pain, however, the medical practitioner should, like, they can do interim treatment, okay, but they should stress the importance of seeing a dentist, because dental treatment is often the definitive treatment of conditions causing dental pain. If dental review is not immediately available, the medical practitioner may consider a panoramic X-ray, it means the OPG, to exclude serious pathology like any gross dental caries, jaw fractures, or jaw lesions. Okay, so first we will read this table and then we will come back for this indications. All right, according to this table, it is a guide to differentiating and managing acute dental pain. So this table is very, very important because it would help you as well what you can do, because here they have made this table mainly for medical practitioner, what they can do in meanwhile time, but you would also get help from this. So if the patient presents with the complaint of intermittent dental pain that is experienced only with the stimulus, which could be the stimulus hot, cold, or sweet food or drinks, and resolve once the stimulus is removed. So what could be the diagnosis for this complaint? Reversible pulpitis. What a medical practitioner can do if the patient presents with the reversible pulpitis is they can advise the patient to avoid that food, okay, and cover any obvious cavity with an inert material. They can try to cover that cavity with the inert material such as chewing gum or blue tack. Advise the patient to see a dentist as soon as possible. And for the reversible pulpitis pain, analgesic and antibiotic both are not required. And what would be a dentist be doing in the case of reversible pulpitis? He would just remove the decay and put a simple restoration or desensitization treatment is required. Then, if the patient would present with the severe dental pain that is experienced when the tooth is exposed to a stimulus, like see here it is severe dental pain, it is intermittent dental pain, okay? So the stimulus are same, hot, cold, sweet food. Then pain is persisting. Here pain completely resolves. So pain is persisting as a dull throbbing ache after the stimulus is removed and can become continuous. So what could be the diagnosis? Irreversible pulpitis. For these patients, what a GP can do, advise them to avoid those food, and he can also prescribe NSAIDs if the patient can use them, because there are some contraindication in which cases we cannot prescribe NSAIDs, such as patients with hypertension, patients with asthma, so other conditions as well. If the patient is old age and he has some GIT related issues, or pregnant women, so those conditions apply, but he can still prescribe the NSAID for the irreversible pulpitis patients. Then cover any obvious cavity with an inert material, and if symptoms are severe, he can also consider LA of the affected tooth or temporary pain relief for inflammation. Like if we will inject an LA injection there, it would help in temporary pain relief, and then the patient can get the dental appointment. And to advise the patient to see the dentist as soon as possible. Antibiotics are not required, but analgesics are required in case of irreversible pulpitis. In reversible pulpitis, nothing is required. And what would be the dentist doing? He may need to do root canal or extraction. Then, if the patient presents to the pain to you with the complaint, dental pain that presents as a dull, boring ache and is not triggered by a stimulus such as hot, cold, or sweet food, tooth may be sore to bite on. So what could so if it is a late stage of irreversible pulpitis where the infection has now going towards the periodontal spaces, so it is a late stage where patient would experience pain on biting. Okay, so it could be infected root canal system with acute periapical inflammation. Then initial treatment, what a medical practitioner can do is, so after the irreversible stage, medical practitioner do need to prescribe the NSAIDs to the patient in every case. Okay, whatever the stage the infection is spreading, he need to prescribe the NSAIDs. And he also need to advise the patient to see the dentist urgently, and antibiotics are not required for a localized odontogenic infection. But if the dental treatment is not likely to be received in 24 hours, then he can start the antibiotic therapy for that oral antibiotic therapy that we read in odontogenic infection case topic. Okay, and what would a dentist do in this scenario? He either need to do the root canal or the extraction. Then, if the patient only complain about tenderness of the tooth to pressure and on biting. This topic we covered yesterday, which is the cracked tooth, where the patient would experience pain on biting and release of bite due to the fluid movement of the dentinal tubules. Okay, so it could be fractured or cracked tooth or localized odontogenic infection. So, what would be the initial management? He should advise the patient to see the dentist urgently. It is difficult for medical practitioner to differentiate a fractured tooth from a localized odontogenic infection, even with the imaging, without a visible pus or abscess or pus to indicate infection. So, offer analgesics, which are NSAIDs are preferred if the patient can use them, and antibiotic therapy is only required if the dental treatment is not being done within 24 hours. Then what would be the dentist doing? If like with the crack, we read that the crack is only the finding. If the tooth which is involved is at the reversible stage, then we can try to put a restoration. Otherwise, we may need to do root canal or extraction if the tooth pulp is irreversibly damaged. All right, then facial. Now the patient has facial swelling and pain, but there is no like severe or systemic signs. Okay, so in this case, a medical practitioner would prescribe the painkiller, and he may need to prescribe antibiotic if the dental treatment is not been done within 24 hours, and he should advise the patient to attend the dentist urgently. So, what would be the dentist doing? Endodontic treatment or extraction? But if the patient has swelling on face and pain and with the severe and systemic sign and symptom, then the treatment would be done in hospital, which would be like they need to do airway breathing circulation support and urgent transfer to the hospital with an oral and maxillofacial surgeon or another expert. And what would be the dental treatment? They would start the IV antibiotics and do the surgical intervention. Okay, so like we have started from this point. So with the reversible pulpitis, they just advise the patient to avoid those things and refer him. From the irreversible pulpitis, they would only prescribe NSAIDs to all the patient, the pain for the pain. Okay, but antibiotics are required from the situation if there is any local odontogenic infection, only if dental treatment is not being done in 24 hours. Okay, so it is the same thing that they do. And what could be the dentist doing in all these conditions, like either the apical periodontitis, irreversible pulpitis, cracked tooth, or the spreading odontogenic infection without severe and systemic feature? They would either do the root canal or the extraction of the tooth involved. But if there is a severe and systemic signs, then hospital they need to refer the patient urgently to the hospital with a oral maxillofacial surgeon unit attached to it. Okay, then dental pain, which is worsening 1 to 4 days after tooth extraction, that it could be alveolar osteitis or the dry socket. So what the medical practitioner can do, he can try to flush or clean the socket with the warm sterile saline until all the debris is removed. And because patient would be in severe pain, so he need to prescribe the patient analgesics, which is the NSAID. Okay, and antibiotic therapy is not required because it is not an infection. Then dental treatment would be further socket irrigation and analgesia may be needed, or an obtundant dressing may relieve pain. Then, if there is any acute onset of severe pain throughout the mouth associated with gingival bleeding and necrosis, or ulcers of the interdental papilla and halitosis, this we read in previous chapter, the diagnosis would be necrotizing ulcerative gingivitis. What management a medical practitioner can provide is the offer analgesics, and because we need to remove that debris, so we need to prescribe them these mouthwashes, and he would refer the patient urgently to the dentist. And what would a dentist do? He would clean the gingiva and remove the plaque and debris, local irrigation and antibiotic therapy, and plus NSAID. So just keep in mind one thing: when your patient is coming with the pain, you need to do something about his pain. You need to do either it is like medical practitioner or dental practitioner. If the patient is in pain, you need to do immediate treatment, which means you need to help him with the pain. The best treatment if the patient comes to a dentist is do the dental treatment if the cause is related to dental origin, and then adjunctively the dentist can prescribe him the medication. Then other things are acute unilateral or bilateral preauricular pain. Mouth opening may be restricted. So it is TMJ related. And what the medical practitioner can do is advise the patient to rest the jaw, and advise some cold and warm compresses, and offer analgesics for the pain, and advise the patient to see a dentist as soon as possible, because we may need to sometimes give the splint, occlusal splint, that would help in relieving those forces. If the patient is doing bruxism or clenching, it would help that patient. And the dental treatment, if conservative measures fail, even after doing all these things like jaw exercises, splint, or pain relief, still the patient is not relieving, then we need to do refer him to the oral medicine specialist or an oral and maxillofacial surgeon, because they may need to do other surgical interventions. Okay, then dental pain that worsens when the head is tilted forward. So it is mainly sinus related pain, maxillary sinusitis. So for this patient, the medical practitioner symptomatic therapy is recommended, and antibiotics are rarely needed, because to cause the maxillary sinusitis, bacteria are not only the reason why it has happened. So the antibiotics are rarely needed for this treatment, and symptomatic therapy is generally recommended. Then the dental treatment is not required. For example, if you find out that the diagnosis, or you are suspecting a diagnosis of maxillary sinusitis, so as a dentist, you won't be doing anything. You need to refer the patient to their GP to do the test and to manage. All right. Thank you so much, guys, for watching my video. Please do like, share, and subscribe. And we will meet in next video where we will cover this topic. Okay. Thank you.